The internet is full of bro science, fake knowledge, half information, or propaganda. Your quest of reliable, authentic health information ends here. So subscribe this channel and hit the bell icon, and you never have to go anywhere else ever again.
Hello everyone, how are you today? I am Dr. Paramjeet and you're watching Dr. Education. Welcome back to yet another video, and today we are going to talk about vitamin D and calcium, but of course. So what is vitamin D, how it is absorbed, and why you might have a deficiency, what happens when you have a deficiency, how much do you need, how much is over, right? What is the toxicity level, what happens when you have a toxicity, etc, etc, etc. Everything will be covered today in this video. And as usual, all my videos are directly referenced from US National Medical Library, so you can trust the information, right? So let's talk about vitamin D. So vitamin D, we all know, is very important for absorption of calcium, right? Vitamin D helps in absorption of calcium and therefore regulates the calcium in your blood and in the bones, right? Because calcium is required for bone formation. One more mineral is required for bone formation. It's called phosphates, right? Calcium and phosphate, these are the two main minerals required for bone formation, maintenance, especially in the early ages, growing ages, and then old ages for maintenance of bone, right? So what are the sources of calcium, sources of vitamin D? The most important, the biggest source of vitamin D is sunshine. Yes, if you actually take 15 minutes of sunshines for like 3 times in a week on your face and arms and neck, that is enough for vitamin D. But sunshine should be early morning sun, and obviously you have risk of increased skin damage, increased skin cancers by prolonged exposure to the sun. Therefore, there are other sources. The other big source of vitamin D are fatty fishes like tuna and salmon, right? Those fishes which have fat content more, all right? And then in small amounts, actually very small amounts, vitamin D is also present in egg yolk, in cheese, in liver, and in mushrooms, right? Animal liver, right? So that's the whole source, limited sources of vitamin D from where you can get vitamin D. So sunshine is very important, or else there is fortified foods. Fortified food, all the foods like milk or cereals or some other food which can be fortified. Vitamin D, B12 can be added into it, right? For addition purposes, for this purposes, there are two types of vitamin D, D2 and D3. D2 is basically called urcocalciferol and D3 is called cholecalciferol, right? Actually, D3 is more important for you. D2 is least important. It is actually less bioavailable. It's actually less important for all the purposes. D2. So that's the recommendation, 15 minutes of sunshine 3 times a week, right? So how can you test whether you have a deficiency or not? The most important thing to take from here is that the test is of two types. One, you can test vitamin D, which is 25 hydroxy vitamin D. Other, you can test vitamin D3, which is 125 hydroxy vitamin D. That is the active form of vitamin D. You don't need to test 125 hydroxy vitamin D all the time, because all you need is vitamin D. You need to check vitamin D stores, right? So 25 hydroxy vitamin D is the main test. 125 hydroxy vitamin D test is done to check if vitamin D is getting converted to active vitamin D3 or not, right? That's a further test to check whether kidneys, because kidney is the main site where vitamin D is activated and liver is one more site, right? So these are the tests which are done, basically vitamin D and vitamin D3, right? So what is the normal value? If we talk about main test, vitamin D, 25 hydroxy vitamin D, the least value, the lowest value, if it is less than this, then you have deficiency, then you have a problem. That means 30 millimole per liter or 12 nanograms per ml. That is the least value, and the highest you can go till, that means the high level of normal range is 125 nanomole per liter or 50 nanogram per ml. So that is the range And what is the RDA, the recommended dietary allowance? How much daily vitamin D do you need? Well, it depends upon your age, your sex, a little bit on your sex, and depends upon whether you are pregnant or not, etc., etc. But for that matter, let's see a little bit of summary. If you are less than 1 year of age, you need 400 international units of vitamin D. If you are from 1 year to 70 years, no matter if you're pregnant or not, no matter if you're male or female, you need 600 international units of vitamin D daily. And if you are 70 years above, you need 800 international units of vitamin D, right? 800 IU. So this is the recommended dietary allowance. So what is the upper limit, right? How much vitamin D can you take safely without any side effects? The upper limit for less than 1 year is 1500 international unit. That means at least almost 4 times, right? Then first 1 to 3 years, the upper limit is 2500. 4 to 8 years, upper limit is 3000, and above 9 years and above, the upper limit is 4000 international units daily. So that's the upper limit of vitamin D. So what happens? How can you actually develop a toxicity? Can you develop a toxicity of vitamin D? And what happens when you don't have enough vitamin D? See, first let's talk about toxicity, right? If you start taking vitamin D, a lot of people are taking vitamin D. A lot of supplements have been, it's available in injectable capsules, sachets, liquid forms, right? Injections are available 1 lakh unit, and it's given weekly basis. Tablets and capsules are available in 60,000 units, and it's given in combination of calcium tablets as well in sometimes 200 units, sometimes 400 units, international units. So what is the toxicity level? See, recommended dosages, if you take 10,000 international units or more daily, that can lead to toxicity in a matter, in some time, not in a few days, but in weeks or months, right? In some studies, they gave like 1 lakh, above 1 lakh international units or several for several weeks also, and there was no toxicity. So that's the point. If you take 10,000 daily for months and months, then for a few weeks, then there would be toxicity. And what happens in toxicity? Obviously, the most important problem is that your body absorbs a lot of calcium. Vitamin D absorbs calcium, so your body actually absorbs a lot of calcium. So your blood calcium level increases. Calcium is excreted in every single thing. Calcium is excreted in the urine, more calcium in the sweat, everywhere, right? So more calcium gets deposited in your organs as well, in your lungs, in your heart, right? Inside, wherever there is place for calcium deposition, right? Calcium finds and deposits there. Right? That happens in very rare cases, very, very difficult to reach toxicity levels of calcium or vitamin D, because mostly in developing countries, people are already deficient, right? And the only source is sunshine, and the only second source are fortified food or supplements. So if you are out in the sun a lot and taking supplements a lot, only then you'll end up like that. Then you can actually have confusions, deliriums, you can have kidney damage, sometimes kidney stones. Then, if you actually have a lot of calcium hypercalcemia, then that can actually damage your kidneys slowly over time and can also lead to kidney stones. See, calcium does not lead to kidney stones alone, but it needs oxalate, well, the calcium is basically, it forms crystals of calcium oxalate, calcium citrate, right? So it needs to form salts of calcium. Obviously, more available calcium will lead to more available salts, but that's not the alone problem, because here many people, 90%, many people are actually deficient in calcium and vitamin D. So you don't need to worry about that as of the cause. Then a lot of calcium in your diet can lead to GI upset. In your GI upset, calcium supplements can lead to nausea, vomiting, stomach upset, right? That kind of a thing can lead to weakness, can lead to weight loss also. So this is all about toxicity of calcium or vitamin D, which is very rare, as I said. Only when you take more than 10,000 units every day for several weeks or months, then you develop a toxicity. Now, the most common thing which is happening is deficiency, especially in developing countries. Deficiency of calcium. Why do you actually develop a deficiency? Number one reason for deficiency is decreased intake. The intake is less. That means that either you're not going out in the sun at all, or you have a darker skin. Dark skin absorbs calcium slowly, vitamin D slowly, and or you might be pregnant. Pregnancy increases your little bit requirement, as well as it decreases the absorption of calcium. Then breastfeeding, if you're breastfeeding, then your child is not actually getting the proper amount of vitamin D, because breast milk is deficient in vitamin D. So that's why for the first year you should give your child vitamin D supplement. Yeah, that's true. It's important. This is the first reason, right? Decreased intake. The second reason for vitamin D deficiency is decreased absorption. So you are taking vitamin D supplements, still your vitamin D is not normal. That means it's not getting absorbed. Why? Either you have a malabsorption problem, malabsorption syndrome, or you have IBD, right? Inflammatory bowel disease, or cystic fibrosis, which is a childhood problem, congenital problem. You might have a hyperparathyroid problem. You might have undergone a bariatric weight loss surgery in your stomach, causing malabsorption, causing absorption problem. You might have undergone radiation therapy for cancers or more anything else. You might have a granulomatous disease, right? Granulomatous disease means tuberculosis, then sarcoidosis, right? Histoplasmosis. In all these diseases, there are a lot of granulomas which form inside the body, which actually calcium is deposited in those granuloma and ultimately lead to calcium deficiencies, right? Or you actually use a lot of sunscreens actually reduce the penetration of UV rays, and UV rays are the main source of vitamin D. But the point is, if you go out for a long time, you will actually end up damaging your skin or end up increasing your chances of having a skin cancer. That's why it's a very narrow line. You need to get exposed to sun intermittently on a thrice weekly basis early in the morning, right? Then some medicines also actually reduce the calcium absorption, including antipsychotic medicine, some bile salt, sequestrin, cholestyramine. There are other medicines also which actually reduce the calcium absorption. Then the third problem here is, even if you are taking it nicely, taking a supplement, it's getting absorbed, it's going in the blood, it's going in the blood as vitamin D. Now still it needs to get converted into vitamin D3, 125 hydroxy vitamin D cholecalciferol. Now this activation is done in the kidney, livers, and therefore if you have a kidney disease, a liver disease, then that it is possible that activation is not happening, and ultimately you are developing a vitamin D deficiency syndrome, right? And liver disease also can lead to that. Kidney disease any kidney disease, any liver disease can lead to that. And the third thing which can lead to vitamin D deficiency is obesity. If you have a lot of fat, the vitamin D is a fat stored vitamin. A lot of fat will store a lot of vitamin D, and actually it will get trapped there. Yes, so a lot of vitamin D is stored in that, so a lot of it gets trapped. So that's also one of the reasons why you might end up in vitamin D deficiency syndrome. So these are all the reasons. But what happens exactly when you have vitamin D deficiency? See, if you have deficiency in vitamin D in the childhood, obviously your bone development will not be perfect. So that's why you will have spongy and elastic bones, right? Bones will be very, very easy to bend and all. So that is something called as rickets. Rickets is a syndrome which is caused if you don't have vitamin D in the childhood developing state. If you are in adulthood, if you don't have vitamin D, then your bones will become weak, not elastic or spongy or bending, but it will become porous. Osteoporosis will happen and osteomalacia will happen. What is malacia? Osteomalacia? It's not that malacia, it's osteomalacia means that your bone will be weak, easy to break. Your bone, you might have bone pains and you will have muscle weakness also. So you will have muscle pain, muscle weakness, and weak bones, right? This is osteomalacia. Then decreased vitamin D, decreased calcium are associated with increased risk of diabetes. Recent researchers have shown very promising result that okay, these are very strongly related to diabetes, cancer, some kind of cancer, breast cancer, colon cancers, and some other types of cancer, increased risk of obesity. So vitamin D deficiency will lead to obesity, and more obesity will lead to more vitamin D deficiency. So it's a cycle. And then obviously vitamin D deficiency will decrease your testosterone and your immunity. Your immune system also requires almost everything in your body requires vitamin D and calcium. So immunity will decrease, testosterone will decrease, diabetes, hypertension, you will have obesity, cancers, and so you will also have increased risk of heart diseases. That's why vitamin D is utmost important, and you need to take care of your sun exposure, or you need to take a little bit of fatty fishes or some cheese, egg yolk, some mushrooms here and there on a regular basis. Make sure to get vitamin D levels tested every year or 6 monthly if possible, at least twice a year. I mean, at least you should know where you stand, right? And therefore you will be able to correct the problem. And dosage of correction will depend upon how much deficiency you have. As I said, they are available in pills, capsules, and injectable forms. So get your vitamin D levels checked. Only check vitamin D, not D3, and thereafter you can consult a doctor for your medicines. This is all about vitamin D, which is there to actually tell you. Hope you like the video, hope you enjoy every single video as I do, and don't forget to share this video. This one particularly is very important for every Indian to watch, and so make sure it reaches the society. All you need to do to stay healthy is stay connected.